Ani Bonjour. Hello everyone. It's Sunday, April 18th, and I'm here to provide you an update on our mental health and addiction strategy. So, as you are aware, on February 22nd, Council approved a recommendation to declare a state of emergency in terms of our mental health and addictions crises that we're facing in the community. And this declaration was made because after careful review of what the community is currently experiencing in terms of addictions in the community, domestic issues within the community, policing, all of these issues are contributing to a crisis where a lot of our members are experiencing depression or overdoses in the community, suicide attempts. So based on what capacity we have in terms of staff and resources, we felt that it's not enough to provide the supports that our members need, and it's not just the amount of resources that are lacking; it's the type of resources, and it's the guidance or the restrictions that we have on these resources that aren't contributing to community healing. So that's why we declared this state of emergency. And since then, we've met with federal and provincial government representatives. We've met with other local partners from the city of Sudbury. We've had some discussions too with our sister nations, Sagamuk and Chaging. And we're basically looking on ways to collaborate so that we can implement a new strategy to deal with the addictions and mental health issues that our members are facing, both on the current reserve boundaries and in the city of Sudbury and other areas, because we do have to provide supports to all of our members regardless of where they live. So our intent, and we've made this clear to the federal and provincial governments, is that we are not happy with the way these health funding dollars, they come with all these restrictions, and they're basically not designed in a way that encourages spiritual growth. And so we feel that having a spiritual presence in the programs is much more important than the more Western-based programming and counseling, where it's more methodical. It doesn't deal with our culture and our language, and that's what our strategy is going to be based on. The 4 pillars, are for community healing, our language and land-based programs, our cultural teachings, and it's all grassroots. It's a peer support type model that we're going to look at, where we are relying on ourselves to heal, and we bring in those supports when needed. So very happy to say that our Director of Health, who's taking lead on the strategy, secured an additional $300,000 to help towards the land-based programs. And now we're going to be working with the trust to hopefully get more dollars for language, and that's something that we wanted to inform you on. So we are listening, and we are going to have a session soon to start things off, to make sure that this is grassroots. So please look for information in our flyers on our website and social media sites for these engagement sessions. They will happen, and we will ensure that we are listening to our members in terms of what they need. So in the meantime, everyone, stay safe, take care of each other. Miigwech, Bamapi.